Thank you to SAGES, and thank you to our moderators for allowing us to present our work. So I'll be presenting our work looking at weight loss outcomes in the setting of bariatric patients using cannabis. We have no disclosures. Cannabis is the most popular federally illicit drug in the US, with legalization in several states leading to increased documented use in the population. The CDC reports that around a fifth of Americans use cannabis at least once in 2019, and estimates among bariatric patients are about 6 to 8%. Despite this, there are still no clear recommendations for perioperative cannabis use. Cannabis has been used to treat a multitude of ailments, most notably to help increase appetite. Studies have shown that cannabis and dronabinol, which is a synthetic THC, have been positively correlated with appetite, and it's been used to help with weight gain in patients who have HIV or cancer. And because cannabis is associated with increased appetite and weight gain, it's traditionally felt to be deleterious to weight loss efforts. There are actually a few studies that have looked at cannabis use in bariatrics, but they don't do a great job of utilizing well-defined metrics. So how they define cannabis use, so how many times a week or month that these patients used, or was it before or after the surgery, and they didn't have very long follow-up times, typically 2 years or less. So our aim was to provide a more comprehensive and detailed look into the differences in bariatric outcomes between users and non-users, specifically utilizing a more precise definition of cannabis use and including follow-up times of up to 5 years in some patients. We performed a retrospective review on a prospectively maintained database identifying patients undergoing bariatric surgery from 2011 to 2020. We did collect data on both sleeve gastrectomy and Roux-en-Y gastric bypass patients, but the gastric bypass patients had to be excluded due to small sample size. The patients were divided into two groups, cannabis users and non-users, with cannabis use defined as use at least once weekly. Users in a group of non-users were surveyed to obtain additional information, such as more details about their cannabis use, as well as details about postoperative nausea and vomiting. We identified a cohort of 364 sleeve gastrectomy patients, 31 of who were cannabis users and the rest not. We did not see any major differences in demographics between the two groups. Looking at excess weight loss outcomes, we see an interesting trend with cannabis users losing more excess weight further out from surgery. There weren't any significant differences up to 2 years, but past that, at 3 years, we did see significantly more excess weight loss in cannabis users and at 5 years as well. Sorry, cannabis users trended towards more excess weight loss. There are a couple of different explanations for our findings. So it's possible that short-term and that there's a difference between short-term and chronic cannabis use, with short-term use resulting in weight gain, but not chronic use. The studies that have shown weight gain with cannabis and dronabinol typically run over a pretty short period of time, usually a matter of weeks or months, typically not years. Another explanation is that cannabis users could be using other substances that can cause appetite suppression or side effects such as nausea and vomiting. When we surveyed our patients about other substance use, we found that cannabis users tended to have greater opioid, tobacco, and alcohol use than non-cannabis users. Chronic cannabis use has also been shown to cause a downregulation of CB1 receptor signaling in the rodent brain, which is the receptor that leads to appetite stimulation. Hervonen et al. Measured CB1 receptors in chronic cannabis users. They compared 30 chronic cannabis users to 28 controls, with cannabis users having an average of 12 years of use with about 10 joints per day. They injected CB1 receptor PET radioligand and did a volume of interest analysis, and they found it to be 20% lower in chronic daily cannabis users compared with control in some areas of the brain. The increased weight loss in cannabis users can also potentially be explained on its effect on the endocannabinoid system's ability to regulate nausea and vomiting. Cannabis has been extensively studied for its ability to reduce nausea and vomiting, but chronic use can have the opposite effect. Cannabinoid hyperemesis syndrome is a phenomenon where patients get episodic vomiting in cases of prolonged and excessive cannabis use. And it's thought to be relatively rare, but the exact prevalence is not clearly defined because reports vary pretty widely. Its pathophysiology is thought to be in part due to some of the same reasons that we talked about in the previous slide, downregulation in the CB1 receptors. Additionally, THC has been shown, THC, which is the psychoactive component of cannabis, has been shown to decrease GI motility, which can also have a hand in causing patients to have more nausea and vomiting. We surveyed patients regarding short-term and long-term post-operative nausea and vomiting, with short-term being defined as within that first year after surgery. And we found that in the first year, users and non-users had about the same amount of post-operative nausea vomiting, which is expected because it's one of the most common side effects after bariatric surgery. But when we looked at long-term, cannabis users tended to have more rates of post-operative nausea and vomiting. We also asked them to rate their nausea and vomiting on a scale of 1 to 5, and we found that cannabis users typically had a higher vomiting score than non-cannabis users. This study is not without its limitations. It was a retrospective study. It was limited to a single center. And given that patients were contacted over the phone sometimes years after their surgery, recall bias is also a consideration. We also didn't collect data on medications that could have promoted weight gain or weight loss, and we didn't collect data on cannabis use prior to surgery, which could have helped us to elicit the true chronicity of use in some of the patients. And while there may be a relationship between cannabis use and long-term post-surgical weight loss, this does not infer causality. In conclusion, cannabis use is prevalent among patients seeking surgical weight loss, but there is a paucity of data on its effects after bariatric surgery. The common side effect of appetite stimulation leads to the assumption that it can be detrimental to weight loss efforts, but we found that cannabis use did not compromise weight loss efforts post-sleeve gastrectomy. More research is needed to confirm these observations among a broader population of bariatric patients and to better understand long-term adverse effects and investigate the intersection of endocannabinoid neurobiology and metabolic surgery physiology. Thank you.